Hello and welcome to the program. I am Ogechukwu Ukekwe. The study of cancer is termed oncology. Cancer have been known to mankind since ancient times. Cancer is a complex group of diseases characterized by uncontrolled growth and spread of abnormal cells, and continues to be one of the most significant health challenges worldwide. Cancer remains a leading cause of mortality globally, with an estimated 19.3 million new cases and 10 million deaths reported, according to Global Cancer Statistics 2020. The burden of cancer is unequally distributed, with low and middle-income countries. Lungs, breast, prostate, and stomach cancer are among the most common types globally. Despite progress in cancer control, several challenges persist. Access to quality care cancer remains a significant issue, particularly in low-resource settings. Cancer remains a formidable challenge, but progress is being made in understanding its causes, developing effective treatments, and improving cancer care delivery. The House of Representatives has urged the federal government to provide funding for the establishment of free cancer treatment centers across the country. The call followed the adoption of a motion on a matter of urgent importance, the need for cancer-free treatment in Nigeria, moved by a member representing the All Progressive Congress in Kano State, Ahmed Yusuf. The lawmaker described the destruction caused by cancer disease and the rising number of cancer patients in Nigeria as alarming. After the motion was adopted, the House Committee on Health Service mandated Federal Ministry of Health to direct all teaching hospitals in the country to immediately establish cancer treatment centers and commence free treatment of cancer patients in their hospitals. The House of Representatives also mandated the Federal Ministry of Finance and Budget Office of the Federation to appropriate funds to ensure the establishment of cancer treatment center. We'll take a short break and the program will continue shortly. Well, joining me to discuss the story in cancer is Dr. Nsiabase Ekanem, public health specialist. Thank you, sir, for joining me on the program. So as a professional, what would you say are the major causes of cancer and what are the treatment options available?
Okay, quite a number of factors increases the risk of contracting cancer. Some factors, in fact, there are a lot of factors, and those factors can be classified into different groups. First of all, we have what we call the biological factors, or what we call the human biological factor. And these are factors including genetic makeups. There are certain genetic disorders that lead to the development of cancer in the long term. Sometimes also conditions, like leukemia actually result from the malfunctioning of the white blood cells, which are produced from the bone marrow. These are some of the biological factors that can lead to some certain kinds of cancer. Again, some kind of cancers are caused by what we call autoimmune disorder, which is a situation whereby the body's immune system is fighting against the body system itself. And these could be as a result of certain genetic factors that are transmitted from the parents to the offspring. And so the offspring begin to manifest some threats that that happen as a result of mutation in the genetic sequencing in the individual. So beyond this, we also have what we call acute acquired immunodeficiency syndrome, not the AIDS caused by HIV, but the immune deficiency that is caused by genetic factors. Sometimes a child is born and some of the immune system some of the immune cells that are supposed to help defend the body system are not properly developed. Some of them are not properly, are not in adequate quantity. And because of this inadequacy, that individual is not able to withstand infections. And we know that certain infections over the long term can lead to cancers. Such infection as human papillomavirus over a period of 10, 15, 20 to 30 years can result in cancer. So the fact that the body is not able to withstand this infection can result in, can lead to or can increase the chances of such an individual contracting cancer. So beyond the biological factors, we have what we call the microbiological factors. And these are the infections that individuals can, contract, which will result in cancer in the long term. So I give a quick example, like I said earlier, the infection with human papillomavirus would lead to certain kinds of cancers, most importantly, cervical cancer, sometimes cancer of the vulva, and even cancer of the buccal cavity, which is the mouth. These cancers are caused because of the infection or through the infection of human papillomavirus. So anyone who is exposed to human papillomavirus of certain strain, because there are about 100 types of human papillomavirus, but anyone who is exposed to certain strains of it, particularly the 16, 18, 52, and 54 strains, those people can actually come down with cervical cancer in the long term, which is why the federal government of Nigeria, through the support of the international donors, have rolled out human papilloma vaccine across the country free of charge in all primary healthcare centers. The idea is to ensure that girl children between the ages of 9 and 13 have access to these life-saving vaccines so that it can protect them from contracting this cancer-causing virus called human papillomavirus. Away from this, we also have what we call environmental factors that can increase the chances of coming down with, cancer. Environmental factors such as exposure to lead, exposure to asbestos. These are carcinogenic agents, which when one is exposed to, it can actually lead to cancer in the long term. Smokers, most smokers expose themselves to smoke in the environment, whether it is from vehicular movement or whether it is from cigarette smoking. That smoke is carcinogenic, and when it is deposited in the lungs over the long term, it can lead to lung cancer. Again, we go back to infections such as hepatitis B. Hepatitis B and hepatitis C are the leading causes of liver cancer across the world. And so the exposure to hepatitis B virus, especially when it is not properly treated, over the long term can make the liver to become cirrhotic, and over a longer term can cause liver cancer. So these are some of the factors that increases the risk of contracting cancer. Unfortunately, these days, the exposure to a lot of chemicals in processed foods, canned foods, also increases the risk of contracting cancer. But the public health measure here that we keep emphasizing is that individuals must always carry out tests.
Okay, so in terms of symptoms, how well can one manage it?
Well, the symptoms of cancer depends on the part of the body that is affected by cancer. So virtually every part of the body is susceptible to cancer, which is why we have the cancer of the brain, cancer of the liver, cancer of the kidney, cancer of the, virtually every part of the body can be affected by cancer. And based on the part of the body affected, these symptoms manifest, of course, depending on that part of the body. But most often, patients report pain, severe pains. And this is because when cancer develops, the tumor begins to expand. And when it expands, it mounts pressure on the adjacent organ or adjacent tissue of the body. And so the pains that is experienced is often experienced within that adjacent organ of the body. It also leads to loss of blood because cancer actually lead to the destruction of blood cells. So patients essentially report anemia. And in cases like leukemia, the patient actually reports occurrence or frequent occurrence of diseases because of the destruction of white blood cells. For cases like liver cancer, a patient typically reports, abdominal pain, nausea, vomiting, loss of appetite, sometimes the discoloration of the eyes, discoloration of urine and stool, and of course, other abdominal symptoms. In case of lung cancer, patients typically report cases like, blood in their sputum. Sometimes they complain of severe pains within their flank. Of course, they sometimes also complain of shortness of breath, wheezing while breathing, and a number of other respiratory symptoms. In cases of cancer of the cervix, that's cervical cancer, patient typically reports, difficulty having sex with their partners, sometimes bleeding from the vagina, and excessive pains within the abdomen. So, like I said, there are quite a number of symptoms of cancer, but that would depend on the particular part of the body that is affected by cancer. But in all of that, the management actually, first of all, begins with pain. So the pain has to be managed because sometimes a certain level of pain can actually lead to death because of the severity of the symptoms. So most times, clinicians will place patients on pain relievers, and that pain relievers are titrated. So from the lowest to the highest, depending on the level of pain. Sometimes also other approaches include radiotherapy, using radiation, to destroy some of the cancer cells. But of course, we know that radiation, the use of radiotherapy, it may not be so much as efficient as the use of chemotherapy, because some of these radiations actually would result in the formation of new cancer cells. We also use surgery. Surgery is used in the early stages of cancer, and the use of surgery is to ensure that the cancerous cell is removed as a whole without affecting other adjacent tissues and organs. Well, then finally we use what we call chemotherapy. Chemotherapy is the use of certain kinds of drugs that we call cancer cure or cancer treatment drugs. These drugs are actually designed, to destroy the cancer cells. By so doing, it helps to cause remission in terms of the cancer, the malignancy within the patient. So essentially, these are the three methods that are used in cancer therapy. And this therapy, these approaches or this intervention can also help in the long run to reduce the load of cancer or even to cause remission. And once the remission is achieved, the patient's quality of life returns back to normal. So this is basically how cancer is being managed. And once it is managed, the symptoms associated with it will also recede at the end of the therapy.
Okay, so we've seen the House of Rep have urged the federal government to provide funding for establishment of free cancer treatment centers across the country. What's your take on this?
Well, that's such an ambitious target. For me, I think while I appreciate that particular piece of legislation, I want to also say that there has to be a holistic approach For cancer treatment to be provided free, somebody has to pay for that. And rather than make it just free from the government, I think the use of social insurance programs must be utilized here. If we're able to strengthen our insurance systems or adopt the mandatory health insurance as seen in countries like Qatar, Rwanda, and many other countries, it will help us to be able to mop up a pool of funds that will be used to finance cancer treatment in Nigeria. The truth is that cancer treatment is a very expensive one anywhere in the world. And for that reason, it is not possible for just the government of the day to be able to provide. There has to be that counterpart funding from the citizenry, and which is where insurance programs come in. And so what we should be focusing on is to strengthen our healthcare financing and ensure that we strengthen the insurance system. We know that our insurance system has suffered a lot of bottlenecks and drawbacks in the past, and that was because partly because of corruption in the system, and of course also partly because of poor contribution from the populace, from Nigerians to that scheme. So what we should be doing here is to, first of all, strengthen accountability within the insurance system. Of course, ensure that there is that contributory funding from the people. So just imagine that we have 200 million Nigerians, and if those 200 million Nigerians put in just 200 naira into that pool, we have over 400 billion, to be able to fund insurance, health insurance in the country. So I think, yes, the legislatures have done what they are supposed to do, but it's now left for the technocrat within the Federal Ministry of Health and its counterpart or partners to be able to structure a health financing program that is sustainable and that is far-reaching, so that the people that actually need access to this healthcare can have it when they need it, in the spirit of the universal health coverage. And so by so doing, we can be able to get everybody on board, no matter who you are. Of course, presently, the insurance system that we have only captures federal government workers and very few of state government workers, and almost nothing to write home about as far as non-educated workers or artisans or casual workers are concerned. In a robust mandatory health insurance program, unskilled workers like the artisans and the local workers should be captured. If we are able to capture the entire population in a mandatory health insurance scheme, we'll have a sufficient pool of funds to finance cancer and other healthcare services in the country. That is a more sustainable way of doing it. It's far more sustainable than asking the federal government to shoulder the burden of financing cancer treatment, because it is very expensive, from the prevention to the treatment and even the palliative care. It is a whole lot of continuum of care in there, and it requires a whole lot of money. So the best way to do that is to strengthen our health insurance system by strengthening accountability, so that the use of funds will be efficient, and also strengthen the collection of funds by ensuring that every Nigerian is part of that insurance system.
Okay, so when these cancer cells are taken out, is there any possible risk of it reoccurring?
Yeah, thank you very much. Yeah, so of course, there's a number of cases of relapse in terms of cancer treatment. We all know that sometimes even during the surgery and other procedure, it is possible that some of these cancer cells would have been missed, while carrying out the procedure, whether it is surgery or radiotherapy. Even in cases of chemotherapy, some cancer cells may have been missed. And also, it is also possible that during treatment, due to conditions or situations such as non-adherence to medications, there might be failure of therapy. But even in cases where there is complete remission in terms of cancer treatment, where the patient is able to completely eliminate all the cancer cells, there's possibility that cancer may develop again. Remember, when I started this conversation, I talked about the risk factors that increases our chances of getting cancer. So after having the cancer treatment, it's possible that exposure to some of those risk factors may reinitiate another incident of cancer, or increase the chances or the susceptibility of the previously remitted cancer cells, in getting back cancer. So we've seen cases, a lot of cases where people who were considered cancer-free now come down with cancer. So, but what is important for all patients is to ensure that there is that follow-up visits to the clinics to ensure that adequate and appropriate tests are carried out to monitor and be sure that the cancer cells have not resurfaced. And when such reemergence occurs, the clinicians are in charge, can take adequate action to ensure that the treatment is given on time to increase the survival rate and, of course, the quality of life of such a patient.
Well, Dr. Isiabasi Ekanem, public health specialist, thank you for lending your thoughts on the program. And that's all we can take on this episode of the program. Thank you for watching. Bye for now.